is the part 2 of common conditions and their impact on participation. Intellectual disability can range in severity based on adaptive functioning and the child's support needs in their daily life. It is characterized by impaired executive functioning. Impaired executive functioning would apply to inhibition, adaptability, emotional control, initiation of tasks, working memory, planning, organization of materials, and monitoring of success during tasks. Someone with an intellectual disability may also have deficits in communication, fine motor skills, which would affect handwriting, drawing, and also visual perceptual skills, which can also affect day-to-day, being able to button, zipping, tying shoes, and more. So some supports for a child with an intellectual disability is to make sure you're giving clear and concise directions and activities and tasks, role model desired behaviors so that they have an example of what they should be doing, provide a structured routine with visual schedules, and then use visual aids when providing instruction. And if they have any sort of communication device, ensure that you know how to use it and that you're using it effectively to facilitate their communication. A learning disability is a neurobiological disorder of cognitive and/or language processing caused by atypical brain functioning. There are a number of different types of learning disabilities, such as reading, writing, memory, math, and more. Someone with a learning disability will have decreased executive functioning, which is planning and regulation of behavior, and they may have difficulty with sustained attention and discriminatory ability. Discriminatory ability is the ability to distinguish and process multiple stimuli. So that would be evident in their reactive stress response, their reaction speed, and ability to pay attention. Some supports for someone with a learning disability is again through communication with their parent and them understand the specifics of their learning disability so you know what is going to affect them specifically. When they're doing tasks that they find difficult, praise effort over their outcome to help them with that frustration, and sandwich more difficult tasks between easier tasks. With your modeling, make sure that you show them that it's okay to get things wrong and provide breaks during difficult tasks to help them relax and focus. For a child with a physical disability, there can be any number of things that are considered a physical disability. Some examples include amputations, spinal cord injury, spina bifida, epilepsy, cerebral palsy, and many more. Someone with a physical disability often has decreased participation in social activities compared to their peers due to that physical disability, and they may have additional social, physical, or mental health issues related to that decreased social participation and the limited opportunities. A main challenge for a child with a physical disability is accessibility in their environment as well as in activities. When supporting a child with a physical disability, we mentioned this in the disability etiquette video, but don't assume that just because they have a physical, or in any child if they have any disability, don't just assume that they need help. Be polite when offering assistance and wait for specific instructions if it is accepted. For a child with a physical disability, definitely keep an eye out for the accessibility of environments and activities. Keep paths clear of obstacles, and any assistive equipment that may need to be used should be functioning and completely accessible. Sensory processing disorder is a condition that should be kept in mind with essentially every child that you interact with, whether or not they have the disorder. We all have sensory processing systems that we should work to understand and understand how to regulate. So the disorder of sensory processing is a neurodevelopmental disorder in which the brain is unable to organize sensory input for appropriate use. It will impact a child's learning ability, behavior, and emotional regulation, as well as their motor development. There are three main subtypes of sensory processing disorder, which are sensory craving, sensory overresponsivity, and underresponsivity. And we will talk about the specifics of these in a later video when we talk about sensory processing. A child with sensory processing disorder typically has difficulty adapting to new environments and interacting socially, and due to that may have anxiety and or depression as a result. Some supports, which again we'll talk about more specifically later, but a structured schedule is helpful, considering the effects of the environment, so recognizing the sensory stimuli that is going on at the moment and understanding how to adapt it to help that child process their sensory inputs. Providing fidget tools, if applicable, headphones, and again, a chill zone to help them regulate their sensory system. A traumatic brain injury can be sustained at birth or later in life, but it will cause difficulties with working memory, behavior, and executive functioning. A child with a traumatic brain injury is at risk of ongoing memory deficits as their brain continues to develop, and they may have post-concussive symptoms, which would be sensitivity to light, headaches, dizziness, depression, anxiety, and difficulty sleeping and concentrating. They will also have an increased risk of developing ADHD, PTSD, depression, learning disorders, and language difficulties. To support a child with a traumatic brain injury, visual aids and supports can be helpful to have that visual input rather than just verbal instructions, providing structured visual schedules and checklists, speak clearly and concisely, giving clear directions, and also allowing extra time to process information and to complete tasks, providing repetition and consistency in directions to avoid any confusion, and demonstrating those tasks and providing examples, again, to facilitate understanding during a task or activity. The final condition we're going to talk about for the purposes of this training is a visual impairment, which can range from reduced vision to total blindness. If a child has some sort of visual impairment, it likely affects their social skills, language, perception of space, motor skills, and their participation in play. They may also experience developmental setbacks due to the decreased participation in their environment. The main supports for someone with a visual impairment is when you're interacting with them, be sure to introduce yourself so that you're announcing your presence. You can look out in the environment to make sure there's high color contrast, which you can see by that far left picture is a common color contrast support. Having those stairs makes it, the contrast between the yellow and the concrete makes it easier to see where the step ups are and just increases the safety of those stairs. Having larger font size on papers and posters, helping the child orient to their environment, so describing the environment for them so they can feel more familiar with it and can be more independent in that environment, and also being cognizant of lighting and any glare in the environment that may affect how they're perceiving it visually. And then we will talk about some assistive devices that may be used later, but in the bottom right picture, we have a sort of magnifying device that helps with reading that a child or other person with a visual impairment may have to help them read. And then high contrast is important to ensure high color contrast between floors, walls, furniture, rugs, cords, anything that may be some sort of hazard. You want to make sure that it's visible as well as that you're announcing it to that person so that they can be more aware of their environment. For the next video, we're going to be talking a bit more about parent communication and how you can use that to provide additional supports for a child in your care.